This is chapter 61 in your book, Assessment of the Endocrine System. And we're going to try to just kind of stay on the surface of the system and not get too entirely deep into it. So your endocrine system is made up of several different systems. You have your hypothalamus, your pituitary glands, your adrenal glands, thyroid gland, your islet cells of Langerhans of the pancreas, parathyroid glands, and your gonads. And this picture shows where everything is located. You can see that your adrenal glands are located right above your kidneys. Of course, your pancreas is located in between those, and it houses those islets of Langerhans cells. Your thyroid is approximately in the middle of your throat area. Your parathyroid glands are directly behind your thyroid. Your hypothalamus and pituitary are located in the brain. And then, of course, I think we all know where our testes and our ovaries are located. So just a little bit about each of our glands. Of course, our hypothalamus is located in the brain itself. The hypothalamus is located just directly beneath the thalamus in the brain, and it has all of these little nerve fibers that help connect the hypothalamus to the rest of the central nervous system. Hopefully y'all remember that your hypothalamus is responsible for regulation in your body, regulation of your thermoregulation system, like your body temperature. It can help regulate your electrolytes, just a number of things in your body. And we'll go over a little bit more of that on this next slide. But your endocrine glands, all of these that are listed here, are responsible for secreting hormones. And these hormones are natural chemicals that are automatically in your body, but they take their effects are on specific tissues known as target tissues. Well, these target tissues are not located like right there where that hypothalamus is or right next to the pituitary glands. They're located somewhere else within the body. So endocrine glands are noted as what we call ductless glands. That means that they have to use the blood system to transport those hormones to where the target tissues are. The endocrine system works with your central nervous system to help control your overall body function. It helps your body maintain the homeostasis, so as well as maintaining your internal environmental changes. It also maintains the external environmental changes. So it may be 100 degrees outside, but because of all of these hormones and all of these glands that we have, your body temperature remains approximately 98.6. Things that are also controlled by your endocrine system are metabolism, nutrition, elimination, temperature, again, fluid and electrolyte balance, and of course, growth and reproduction. So we just said that your hypothalamus is primarily responsible for regulation inside your body. The hormones that are, the regulatory hormones that are produced in the hypothalamus are released into the blood, and they travel to your anterior pituitary, where they can either stimulate or inhibit the release of the pituitary hormones. Now, your pituitary gland is located at the base of your brain in this really nice protective pocket of your sphenoid bone. It's divided into two different lobes, but you don't have to remember that. So, in response to the hypothalamus releasing these hormones, the pituitary gland also secretes some of its hormones, and then that helps to stimulate other endocrine glands. some of the pituitary hormones that are released or as prolactin. And if you look at the chart on page 1256, table 61.1, it lists all of the glands and what hormones they specifically release. I'm not going to require you to know all of these, but we will talk about specific ones for this particular chapter. And this particular chart just shows the basic hypothalamus and where the pituitary is located in regards to it. And just remember that the hypothalamus and the pituitary gland kind of work together. So if one is malfunctioning, then that can cause problems in other areas as well. So onto our endocrine glands and our adrenal glands. The adrenal cortex and the adrenal medulla, again, are located right above the kidneys. They have, and the adrenal cortex is the outer part, and the inner part is the medulla. And they have a lot of different hormones that have effects throughout the body. The two main hormones that you see with the adrenal cortex are your mineral corticoids, which are steroids, and then your corticosteroids. And then the other one that you will see along with that is cortisol. Your mineral corticoids help control your body fluids and electrolytes. And remember that aldosterone is your major mineral corticoid, and aldosterone helps to maintain that extracellular fluid volume. So that's the fluid that's on the outside of the cells. And aldosterone helps to promote sodium and water reabsorption in the kidneys, and then potassium excretion through those kidneys. Renin is also produced by special cells in the kidneys, but just know that part, that renin is produced as well. And one other thing is your serum potassium levels also helps to control how much aldosterone is secreted. Glucocorticoids are also produced by the adrenal cortex, and your glucocorticoids are essential for life. The main glucocorticoid produced by the adrenal cortex is cortisol. Your cortisol is used for your fight or flight syndrome. It affects your body's response to stress. It can affect carbohydrate, protein, and fat metabolism, emotional stability, things like having high amounts of anxiety, immune function, how well your immune system is functioning, and of course your sodium and water balance. Your adrenal cortex accounts for 90% of the adrenal gland and is divided into 3 layers. You don't have to know those 3 layers, just know that there are 3 layers. And also your adrenal cortex does secrete small amounts of your sex hormones, your testes, and your estrogen. Like I said, sex hormones, your androgens and your estrogens are secreted in very low levels by your adrenal cortex. But in women, the adrenal gland is the major source of those androgens. The adrenal medulla is basically a nerve ganglion. It just has a lot of secretory cells. It helps to stimulate the sympathetic nervous system to release catecholamines, basically your norepinephrine and epinephrine. And these hormones will travel to all different types of areas of the body through the blood and put their effects on those specific target cells. These hormones are not essential for life because they are also secreted in other body tissues, but they do play a major response in the stress syndrome. So just remember that your catecholamines play an important part in your stress response. Your thyroid gland. Your thyroid gland is responsible for a lot of different things in your body. When we think about thyroid gland and deficiencies, we can think about things like hair loss, sometimes weight gain, cold intolerance. We'll, in I think chapter 62, start talking about Cushing's disease and Addison's disease, which are types of thyroid conditions. But we're just going to kind of hit the high points. Your thyroid gland does help control your metabolism. It is composed of a follicular and parafollicular cells. Your follicular cells produce your T3 and T4, which are the lab results that you'll be checking if you feel like your patient has a thyroid disorder. And your parafollicular cells produce your calcitonin, which helps. Your calcitonin, again, helps to regulate your serum calcium levels. We learned that last semester. Control of that metabolism occurs through your T3 and T4. Both of these hormones can increase metabolism, which can cause an increase in heat use and heat production in all of the tissues. T4 can be converted to T3, and just remember your T3 is your most active thyroid hormone. You don't have to know how it's converted. Just remember that T4 is converted to T3. The conversion of T4 to T3 can be impaired by things like stress, patients who are starving themselves, some medications, and also cold temperatures can help to increase that conversion and make it a lot quicker. There is also a table on page 1259, the functions of the thyroid hormones. Again, the thyroid hormones control your metabolic rate. They can regulate protein, carbohydrate, fat metabolism. They can increase your red blood cell production, and they can also affect your respiratory rate and drive. That's why when those patients that have had thyroid concerns can have an increased heart rate or a slower heart rate, depending on whether they're hyperthyroid or hypothyroid. So just some basic assessment measures. We want to make sure we do a complete patient history, whether they have a family history of thyroid disorders or in some cases even diabetes, how old the patient and gender of the patient can come into play, whether they just have any endocrine disorders in general. Thyroid problems are more common in women. And the use of also of hormone drugs, even things like progesterone and estrogen can play a part. And also nutrition history, nutrition changes or any type of gastrointestinal disturbance can reflect endocrine problems. Ask about nausea, vomiting, abdominal pain. Ask about diabetes. There are specific diabetic insipidus that can cause excessive thirst, and we'll talk about that later. Nutrition deficits from an inadequate diet, especially things like protein and iodine-containing foods, which are saltwater fish, seafood, even just table salt can cause an endocrine disorder. We need to teach your patients about well-balanced diets. They need at least 60 grams of protein daily, less animal fat, fewer concentrated sugars, and then those that don't eat fish on a regular basis need to be taught to making sure they're salting their foods. Now, granted, we don't want them over-salting, but we just need to make sure they have that iodine in their diet. So, current health problems, changes in energy levels, endocrine problems can cause extreme fatigue, especially thyroid problems. Ask them about any change in their ability to perform their ADLs, assess their current energy level. Elimination is also affected by the endocrine system, so just ask, have they had any increase or decrease in their urination. Sexual and reproductive functions can be affected with endocrine. Ask women about changes in their menstrual cycle, increased flow, duration, frequency. Ask men about whether they've had any trouble with impotence or a change in libido. And then, of course, we come into the physical appearance, which is on the next slide. So physical appearances, we're looking for a prominent forehead or jaw, a round or a puffy face, which sometimes may be called a moon face. You see that with Cushing's disease, a flat or dull expression, exophthalmos, which is also called the bug eyes. Vitiligo are patchy areas of pigment loss. Those melanocytes that we have in our body start not to function properly, so you'll get some skin that's a little bit lighter than others. You see this with primary hypofunction of the adrenal glands. You see it most often on the face, arm, neck and legs, and then again you just have large areas where the pigment is uneven. Striae is they're purple stretch marks. You see them a lot on the breast or abdomen, and they're again seen with adrenal concerns. You can also see them a lot of times when patients have gained a good bit of weight. Hirsutism is excessive growth of body hair. You see this a lot on the face and the chest, and a lot of times down the center line for women. You can see excessive scalp hair loss or changes in their hair texture. Something else you'll also see a lot with thyroid problems or a loss of hair or alopecia, or just changes in the texture and the distribution of the hair. So laboratory testing that we will look at for these disorders. So each individual system or body part can have like a stimulation or a suppression test. All a suppression test is it measures specific hormone blood levels. It doesn't necessarily distinguish between normal and abnormal. It just measures the amount inside the body itself. Assay test, again, measures the level of a specific hormone in blood or another body fluid. You see these a lot with endocrine type testing. You don't have to know the names or really anything about these. Just know that there are specific laboratory testing. Of course, you can check urine test for your blood glucoses if they are diabetic problems. Imaging assessment. MRIs are the most sensitive method for imaging of the pituitary gland. CAT scans can also be used, but MRIs with contrast are the most sensitive. The thyroid and parathyroid glands, ovaries, and testes are evaluated by ultrasound. And then your CAT scans are used to evaluate your adrenal glands, ovaries, and pancreas. Needle biopsies can also be used to look at thyroid nodules. And those are the primary tests that we see with your endocrine systems. We basically look at our system, see what kind of problems we're having, and just do our normal evaluation. And that is the end of this chapter.